lot of opportunity for regulatory, certain aspects of clinical design quality that doesn't have to be on site. You've got these high cost of living places. It is a supply demand area, like, regulatory. For every 50 positions, there's like 4 qualified people. It's a very challenging market, and companies limit themselves geographically without it. And so I think obviously the pandemic has shown that there are a lot of positions where you can bring value and do well and not be on site all the time. And then there's certainly a benefit to the company in terms of that cost of the location. Yeah. So I'd like for you to maybe share a little bit about that op-ed and your perspective there, because I think it's really insightful.
Yeah. I refer to it as the world of work. Historically, especially in the MedTech industry, for the most part, we've been a perm-minded employment sort of environment. Certainly, the contracting business has been there. A lot of times, it's been a couple consultants here and there who are usually these specialists who come in, and let's just have it revolve around reg, clin, and qual right now. So those hired guns will come in, and then on the contract side, it's typically been, factory floor people, skilled assemblers, things of that sort. But what's happening right now, especially with the pandemic, is, look, a crisis is a terrible thing to waste. We are now starting to understand that, one, remote is a possibility. I don't think you can build a MedTech company around a pure remote play. Certainly in the early stages of a startup, you can have different players around the country. But once you start to put together a medical device and you start to get into that B round and you've got to have teams there, it's really tough to play around. But to your point, most of the MedTech is located in Southern Cal, Northern Cal, Boston, and the Twin Cities. Yeah. And the level of talent available in the country is much more robust than those 4 areas. And there's some incredibly talented people that, for personal reasons, professional reasons, do not live in those areas. And Absolutely. So most organizations have limited their talent pool to a few things. 1, the people they know. 2, the only people available within 40-minute commute, right? And then 3, historically, we have been in the MedTech industry tied into making medical devices, things that we could put our hands on. But as we transition quickly into this digital world, a majority of medical device companies are not wired, no pun intended, for the digital world. And so the skill sets we're going to have to bring in from the outside into the MedTech industry already exist in telecom, some in the consumer products market, certainly in some other digital therapies, digital products. And those people don't need to be MedTech experts, but they need to be tech experts in a very specific vertical that maybe come into the company for 12, 18 months at a time. And they're accustomed to living in a corp to corp or LLC or 1099 world. And if you think you're going to compete, if you're going to put Medtronic and J&J and Boston Sci, even though Boston Sci doesn't do any CapEx or robots, so to speak, up against, and you're going to try and beat Intuitive at their game as a category example, you are not going to find the talent in the MedTech industry on the software firmware side or the system side that exists that you can bring those people in. You're going to have to go outside your industry, and you're likely going to have to go outside your geography. That sets up for a contractor interim world. So that's one category. And the other side too is this pandemic has handed a lot of really lousy cards to the 50 plus population that were either furloughed or underemployed. Those people likely coming back on board in the form factor that they had previous to the pandemic, I hate to say it, I think is less than optimal. Yet the skill, the talent, the experience they have is unmatched. And there will be forward-looking organizations that will create opportunities for those people to get hired in Boston to work out in Iowa or vice versa. And I think that 50 plus crowd that is going to have a hard time becoming a perm employee, a W-2, will have a wonderful last 10 or 15 years of their career in a interim to perm world or a straight up interim world, making more money and learning how to negotiate their own benefits their own PTO, and start to get that business mind of, I'm not going to allow the system to take care of me. I'm going to drive the outcomes of my life the last 15 years of my career. And it's not that hard. Let me get off my butt, get myself an LLC, get myself some decent tax consulting, and then market myself to the industry in my area of expertise. And those people are going to create a brand new category in MedTech of talent.
With better quality of life, with better autonomy,
and more choices on product too, Darwin. So, they're going to be able to get intellectually, the plasticity of their mind is going to be so much more robust because they're not going to be eating the same tuna fish sandwich for the next 7 years. They're going to be able to cherry pick on products as if they're working for a consulting company, yet it's their company. And they just have to get used to it. Everything is difficult in the beginning that you're not used to. And after a while, it's just, it becomes rigorous du jour.
And the energy and the enjoyment they're going to bring to that process, I think I would say that they're going to be more energized than they've probably been for the last 10 years because of it, once they're in that process.
That's right, because MedTech tends to have really, really, really smart people, and maybe as important, people stay in MedTech for a mission. They're not mercenaries. They are mission-driven human beings. A majority of MedTech people could make more money in other categories of businesses, but they have remained in MedTech because they have a missionary mindset. Is the patient and humanity is more important to them than the paycheck. And so they will get a chance to have a bigger impact with a missionary mindset than they had maybe previously.
Yeah, that's exactly why. That's another reason why I love regulatory quality and clinical engineering. People care. They care about how that product benefits patients, and that's exactly why they're there.
The hardest person to recruit or the category are reg, clin, qual people, especially reg and clin people. And all you reg and clin people, think about this when I say this. When my firm calls a reg person or a clin person and they're in the middle of a sub or a trial, you can't recruit them out. They're not going to leave their mission. They're just not going to leave their team. They're not going to leave their patients. They're not going to leave the mission they're on. Now, you want to find out when that clin trial either finishes up good or bad, then, man, they're available and they're gone. And so that's the evidence that clin and reg people are mission driven, and you cannot knock them off their initiative 99% of the time.
I can't tell you how many times I've talked to regulatory people, I'm recruiting for something, and they're like, I'm in the middle of this submission, I'm in the middle of, and I just can't, I couldn't do it. So you're spot on.